I'm here today with an update on my Invisalign. I'm going to let you know what my treatment consisted of. My treatment consisted of, first of all, an adult dental expander for the upper and for the lower arch. It was an expander that I had to wear for about 6 months. After the expander, or I should say during the process of the expander, and until now I'm doing myofunctional therapy. Myofunctional therapy is a therapy to teach you proper position of your tongue. Okay. Before this treatment, my tongue would always sit on my lower arch, like this. Now with this therapy, I am learning proper tongue position, which is to keep the tongue on the roof of my mouth, like this. Something that I could not do before, okay? And the reason I got this treatment, why did I get this treatment? Okay, the reason I got this treatment was because I had a prior orthodontic treatment. With my prior treatment, I had 4 bicuspids removed. That was many years ago when I was a child. And most people have 8 bicuspids. I'm left right now with 4. The bicuspids are the teeth that follow the canine tooth. This one's right here. Those are like little premolars. I had them removed and I was left with open spaces. And in order to close the spaces, what they did was they pushed everything back, retracted everything, which gave me kind of a sunken face. Okay, that didn't bother me much. What bothered me much was that my face always felt really tight. My muscles in my face were very tight, and I could not feel like my tongue was in a correct position. It always felt like my tongue was too big for my arch. And the reason being it felt that way was because everything was pushed back. So it's like if you have you're wearing a shoe and your foot is a size 7 and the shoe's a size 6. So in other words, my arch got pushed back and it felt too small for my tongue. Okay, so that's why I got this treatment. I went through a lot before this. I had physical therapy. I did not want to have orthodontics again, so I tried everything possible to avoid it, but I couldn't. So I found an orthotropic doctor that did this type of work, that does this type of work. They worked with adults, does an expansion, exercises, and after that, he does an Invisalign treatment or braces to close the spaces that are open during the expansion. But this time, instead of pushing everything back, he brought everything forward. I feel like my lips are supported better, like I could breathe better, and I lost a lot of weight. I don't know if it's because I'm getting more oxygen into my body or because during the treatment I couldn't eat much because I was always wearing an expander and now Invisalign. I'm almost done with my Invisalign. After this, he told me he was going to do some refinements to make some corrections. Whatever the treatment did not achieve, he will achieve with the refinement. Okay? If you have any question, any comment, would like to share an experience, I would love to hear. After doing a lot of research on the internet, I know that I'm not alone. That a lot of people had their 4 bicuspids removed, retraction. Some of them got lucky and it did not affect them in any way, and that's great. But some of us, it has affected us in our on our airway, tongue posture, and other issues that people have that were even worse than me. I felt mine were pretty bad, but I hear people that cannot even breathe and have severe sleep apnea because of this treatment, that they had their teeth retracted. Now, my next step is going to be refinement. I hope they come out well, and this is how my arches look. Any questions, please let me know, and please subscribe. And like I said, I would love to hear anybody who had a similar experience.